Hello everyone and welcome back. If you have recently given birth or preparing for postpartum recovery, then this video is for you. And if this is your first time of seeing this page, don't forget to follow this page, like, share our videos and also subscribe to this channel. There are so many things that occur during postpartum. So today we'll discuss common vaginal changes after childbirth. That is those changes that occur in the vagina after childbirth and how you can heal and feel your best very fast. The first one we are going to discuss is immediate postpartum changes. That is those changes that occurs immediately after giving birth. The first one is bruising and swelling. Right after birth, the vaginal area may feel swollen and sore. This is usually normal and usually fades within weeks or days. The next one is lochia, that is postpartum discharge, vaginal discharge. You will experience lochia, a mixture of blood, mucus and tissue from the uterus. It starts red and gradually fades to yellow-white over 4 to 6 weeks. The next one is pain and perineal discomfort. If you have had tearing or episiotomy during delivery, you might feel some certain discomfort. That is, you feel pain around your perineal area. So sitz baths, ice pack and prescribed pain medication will help. The next one is hormonal and structural changes like vaginal dryness due to estrogen levels dropping, especially if you are breastfeeding, which can cause dryness. Using a water-based lubricant or vaginal moisturizer can help. Then the next one is looseness or tightness. Your vagina may feel looser initially, but it will naturally regain its elasticity, that is its tone, over time. But what can help you to regain it is Kegel exercise. Perform this exercise. Next is changes in sensation during sex. Some women experience discomfort during sex or reduced sensitivity. So you have to go slowly or use lubricant and prioritize foul play. The next one is urinary incontinence. That is the changes that occurs in the bladder. You might leak urine when sneezing or laughing due to weakened pelvic floor muscles. So Kegel exercise can help you regain the elasticity. The next one is perineal healing. If you have had a stitches or that is episiotomy, keep the area clean and dry. Consult your doctor if you have or notice any signs of infection during that areas. The next thing is emotional or long-term recovery. Healing is different from everyone. Give yourself the grace and seek medical attention. If you notice that something does not feel right with you, maybe you are depressed lately, you should consult your doctor. So in consultation of doctor, if you experience any severe pain or foul smelling discharge, that is foul smelling lochia or heavy breathing after 6 weeks or ongoing, or incontinence, you can consult your doctor. Those things are not normal. So if you like today's video, don't forget to subscribe to today's video, like our videos, comment, turn on your notification bell to know whenever we post our videos. See you in my next video. Bye.